music. Hello, and welcome to this video on typhoid fever. Typhoid fever is a bacterial infection caused by the bacterium Salmonella typhi. It is an acute illness that can be fatal if left untreated. Typhoid fever is spread through contaminated food and water or by coming into contact with someone who is infected. Symptoms of typhoid fever typically appear 1 to 3 weeks after exposure to the bacteria. The initial symptoms include a high fever, headache, fatigue, muscle aches, and a sore throat. These symptoms can be mistaken for other illnesses like the flu or common cold. However, if left untreated, more severe symptoms may develop, such as diarrhea or constipation, abdominal pain, and a rash of flat, rose-colored spots. So, how is typhoid fever diagnosed? The diagnosis of typhoid fever is typically made by blood culture or stool culture. A blood culture can detect the presence of the bacteria in the bloodstream, while a stool culture can detect the bacteria in the stool. It is important to get a proper diagnosis as soon as possible to start treatment promptly. Treatment for typhoid fever involves antibiotics. Your doctor may prescribe one or a combination of antibiotics depending on the severity of the infection. It is important to finish the full course of antibiotics, even if you start feeling better, to ensure that the infection is completely eradicated. Prevention of typhoid fever is essential, particularly in areas where the infection is common. This can be done by ensuring that food and water are properly sanitized and by practicing good hygiene. You should always wash your hands regularly, particularly before handling food or eating, and avoid sharing food or utensils with someone who is infected. If you are traveling to an area where typhoid fever is common, you may want to consider getting vaccinated against the disease. The vaccine can help prevent the infection and is recommended for people who are traveling to areas where the infection is common or for those who work in high-risk settings like healthcare. In conclusion, typhoid fever is a serious bacterial infection that can be fatal if left untreated. It is essential to practice good hygiene and take preventative measures to reduce your risk of contracting the disease. If you experience any symptoms of typhoid fever, seek medical attention immediately to receive prompt treatment. Outro music. Thank you for watching, and don't forget to subscribe to our channel for more informative videos.